Hello. I'm hoping I can keep you awake for 10 minutes before you go home. So yeah, just I did a project or a research piece looking at the palliative care key worker, and I really wanted to find out what the caregiver's perspective was of this role, because I feel that although the role impacts the patient, it really heavily impacts the caregiver, whether that be family or friend. And these are unpaid caregivers, so they're really our extended part of our workforce. They're probably bigger than our paid workforce. Um, so really, why did I choose MND? So I wanted to look at caregivers who were looking after someone living with motor neuron disease. And I suppose I understand. I'm a district nurse. I should have said that. So I'm an advanced nurse practitioner in district nursing. I've had this role. I know how challenging it is. I understand it from a personal and professional perspective. And I'm just passionate about the role, and I just feel that it's probably undersold and probably not very well recognised across probably internationally, really. So looking at MND, I suppose we're getting a lot more rarer conditions such as MND out in community settings. You know, people are being looked after in their own homes. You know, and I suppose it brings its own challenges. You know, it's not typically like a cancer diagnosis. You know, it can last for several years, which means the palliative care lasts for years, which means really the palliative care key worker should be in there at the point of diagnosis, you know, and not necessarily then when maybe symptoms become unmanageable and need controlled. So it's just getting sort of the word out there. And I suppose the palliative care key worker role is underpinned by policy since 2004, and really I don't feel we've gotten very far in 21 years, and that's nationally. So it's a little bit sad, but I'm hoping things are sort of in motion now in this past sort of year or two, so hopefully that will improve. I suppose ultimately it's to support people and their families, really, and to support the person with MND to live and die well at home. And ultimately that's where most of our patients want to be, is at home. They don't particularly want to be in hospital. They want to be surrounded by their own families. So I've said, I mean, the participants that I interviewed were, 3 of them were bereaved already. So I suppose they'd been through the journey and were sort of out the other end, but probably some of them were angry maybe at issues that they had throughout the palliative care journey, things that maybe weren't picked up on time. And then the other participants were going through the journey. Okay, so the key findings really, I mean, the key worker did help to support the caregiver to ensure that their loved one remained at home, but we only get one opportunity to get it right. And those people who did have a palliative care key worker, they had a seamless delivery of care, so it showed that it worked on most occasions. Unfortunately, it depended on where you lived, whether you had one or not, which is very sad. It's like the postcode lottery. Some caregivers considered admission to care homes and hospice because they'd no support and they'd no knowledge of what services were available to them. So I found that quite astonishing and very, very sad. You know, I think they go through our fractured healthcare system, which it really is, and they maybe meet 3-4 different professionals along the way, but the dots aren't connected and it's very disjointed, and I think that's where the issues occur. There was no real understanding of what the role was, and that was really from the caregiver's perspective. They thought, you know, well, it's the district nurse, that was the role, but they didn't realise that the district nurse, I probably should have said this at the beginning, so the district nurse is the one identified as fulfilling this role, and they're really there to coordinate and be a single point of contact for the family and the patient. So really there was missed opportunities of care. They didn't know who or when to ask for help. So implications for practice. So really, you know, we want to prevent those hospital admissions, unwarranted ED attendances. There's too many people with palliative care needs still attending our ED departments when things could be managed at home. And I think it really is the right person in the right place, right time, and right skills to enhance that palliative care journey. The role does increase effective use of resources because they are coordinating that care, and they are really, as a single point of contact, they reduce the care burden. If they have an issue with something, whether it be equipment, whether it be specific care needs, they just have the one phone number to ring, and that's their single point of contact. So it takes that stress out of, do I ring the physio, do I ring the OT, do I ring the nurse, do I ring the GP? If they ring the district nurse as the palliative care key worker, then they coordinate all. And that is a big task on the district nurse, and I'll talk about that in a minute. So I suppose caregivers did see that it played a pivotal role, and it did help them navigate the obstacles that they came across. And I suppose they were really key in anticipatory prescribing as well. So they were able to initiate through the GP whenever they built up such a good rapport with patients and their families, and they could see the deterioration and they could identify that early, and then they could get things put into place to keep the person comfortable. And it is about listening. And somebody told me once that you've got 2 ears and 1 mouth, so you should be listening twice as hard. And I do think that's really, really key. And I think sometimes if you go in and sit in someone's home and you just listen, I think there's a massive stress taken off their shoulders already. So implications for education. So we know the Palliative Care and Partnership already identified 2 years ago that education was a priority, and really there needed to be a regional framework identified for the palliative care key worker educational needs. And I know in Northern Ireland that is being worked on. It's not there yet, but I think at the minute everything's very disjointed. I can't speak for the south of Ireland, but in the north, the 5 trusts are all doing something different. And really, it's not a big area. We should all be singing off the same hymn sheet. So I think that's really important. And I think the caregivers need educated as well. They need educated on what the role is. They actually need educated. It came across very clearly to me that, one person said to me, I feel like I am the nurse. I'm doing the suctioning. I'm doing, the personal hygiene. I'm doing all those things. And nobody's taught me any of this. I've taught myself. And I just felt so guilty listening to her. It was sad. And yeah, I suppose for staff as well, it is that ad hoc provision of training, and there's a lack of evaluation of the education that's being delivered, and it's not aligned to any competency framework. And I suppose implications for management, well, wouldn't we love them to just give us lots more money, put the resources into palliative care, but ultimately that's not the case. So I suppose I feel very strongly for district nursing, and I think it's profession critical for care provided at home, and really the district nurse needs facilitated and supported to fulfil this role, because I think it's a really important role, and I know that whenever it's carried out well and whenever it's introduced into a patient's palliative journey early, it's really well received. So basically, the lessons I learned from this was the complexity in navigating the healthcare system. And I think until a caregiver actually explains to you what they've been through, you're like, right, okay, because you're only seeing your own little world, your own speciality, and you're not seeing obviously the bigger picture at times. And I suppose the confusion among patients, caregivers, and healthcare professionals. I think healthcare professionals as well, not everyone knows about the palliative care key worker role, and that is the district nurse's responsibility. And I think sometimes in hospital, whenever somebody's discharging home, they're very quick to refer on to our specialist palliative care teams, which are few and far between. They don't realise they need to just refer to the district nurse, and the district nursing team then pick up on that. And it's only obviously when complex symptoms or complex needs occur then that they need referred on to the specialist palliative care team. So I get with the mini mentor about the generalist education. I think that's so important, and I think palliative care is everybody's business, and I think it is down to everybody, even down to our catering staff, domestics, in the hospital setting, that they have an awareness as well. It's kind of, there's a big push on frailty at the minute, and, they're training everybody, and I think it's very difficult. You're kind of fighting for that mandatory training, who comes first. But I think palliative care has been out there for such a long time. We need to push. I always think people will forget what you said and did, but they'll never forget how you made them feel. And I think the role really supports that. So that's just briefly, I've been trying to disseminate these findings just to promote the role. And then building next steps. Would love to get more PPI involvement and more public engagement, and more probably engagement with all 5 trusts in the north. Thank you.
Thanks a million, Maria. I suppose one of the things that strikes me is we talk about education and going into practice, and that key issue that you saw, that key implication was that it's about educating about the role, but also the person in the role having the education to do the role
Yes.
at its fullest. And is that starting to hit?
I think health trusts are starting to realise that now, and they're starting to recognise that need, and it's just taking time. But how long do we have? And how long do our patients have? And I just think it needs to be at the top of the agenda, which I do believe it is.
Slowly.
Yeah.
Any
Yeah.
questions or comments from Maria on that work that she presented?
They want to go home.
Thanks a million,
No
Maria.
worries.
Appreciate it.